Let's talk about wide receiver for the Jacksonville Jaguars, Kirk. So a few weeks ago, he ended up coming down from catching a pass and started grabbing his groin and his hip area. And initially, he was ruled out of the game with a hip injury, and then later termed a groin injury, and then finally an abdominal injury. So his final diagnosis ended up being a sports hernia. And I want to dive a little bit more into what a sports hernia is and what it isn't, why it's a little bit different than a traditional hernia that we may think of when we hear that term, and then a little bit more about how we can manage these athletes that do have a sports hernia. So when we hear the term hernia, a lot of us, rightfully so, think of a perforation or a tearing of the abdominal wall or a protrusion of something as well around that general area. However, in a sports hernia, there really is no true protrusion. There's no perforation of or pushing of anything out of a cavity. Instead, we have to look at the angle of pull between your groin muscle and your abdominal muscle. And the two muscles we're specifically referring to are your adductor longus muscle and your rectus abdominis muscle. So your adductor longus muscle is, just as the name implies, the long muscle of your groin that attaches to a part of the front of your pelvis called your pubic ramus. And it attaches at an oblique angle or a diagonal angle. When we look at the direction of pull of your six-pack muscle, your rectus abdominis muscle, it actually has more of a true vertical pull. And as we can see on this diagram, there is a mismatch between the diagonal pull of your groin muscle and the vertical pull of your abdominal muscle. And so that's where a lot of the injury or the disruption occurs in a sports hernia. So when we have somebody that participates in an activity or sport that demands a lot of pivoting, twisting, cutting, kicking, things like that, we're thinking about sports like lacrosse, basketball, rugby, soccer, football. And Kirk's a wide receiver in the NFL. So he's doing a lot of pivoting, twisting, jumping, landing on one leg as a wide receiver. So this sets up that irregular angle of pull that naturally exists within our body right in that groin area. And so that's where a lot of the disruption happens. We have to make sure that this is in fact a true sports hernia and not just a simple strain of the groin muscles or a strain of the abdominal muscles, but that it truly occurs at that intersection, right at that bone there on the front of your pelvis. So there was a study that was published a few years ago that looked at how sometimes the hip labral tear was missed in a case of a sports hernia and vice versa. So it's going to be really important that we're able to identify the correct structure that's involved and that's contributing to the athlete's symptoms. So if an athlete comes in with significant groin pain, we want to make sure that it isn't truly coming from the hip labrum, but that it is coming from a sports hernia type injury and where those two muscles intersect right across that pubic ramus on the front of your groin. It's also important to take a look at some of the movement patterns that may contribute to the reason why somebody developed a sports hernia to begin with. This is usually a diagnosis that occurs over repetitive microtrauma. This is not an injury that occurs just out of nowhere with one big hit or one wrong move. Now that one big hit or one wrong move can send the athlete over the edge in terms of some of the abdominal or groin pain that they're experiencing. But it's going to be really important that we're able to correctly look at the way that athletes move and think about things like their torso rotation. Are they lacking torso rotation and they have to borrow that rotation from somewhere down the chain around their hip and pelvis area? And then same thing, are they lacking any hip mobility or rotation deficits that now they have to borrow some of that rotation from their abdominal region? And that can contribute to a sports hernia as well. So one of the hallmark signs of a sports hernia is that the athlete will have difficulty rolling over in bed. They'll have difficulty when they cough or sneeze because that puts pressure on that inguinal ligament down there in the front of your groin. And so one of the things that's really important is to not just look at the hip and some of the movement patterns as well, but to rule out other things, right? Like any abdominal organ injury, any abdominal musculature injury. One more thing to add is that sports hernias can be difficult to diagnose. So a lot of times as a clinician, a sports hernia will see you before you see it. So I've seen a few of these injuries in my career over the past 10, 11 years, and they are few and far between. But when they do come about, it's really important that you're able to correctly identify them and correctly treat them so that the athlete isn't in a world of pain for anywhere from 6 to 8 months, so we can quickly get this managed and then go on about whatever activity they need to participate in.